Hello, and thank you all for joining us today. Today we're going to be talking about the steps taken to diagnose someone as having a form of dementia. Today we are going to talk about the steps taken to identify someone as having dementia, some of the evaluation methods that are used in making a diagnosis, symptoms of different forms of dementia, and common treatments for dementia. Dementia is a general term for a decline in mental ability that interferes with daily life. A person living with dementia may exhibit memory loss and a decreased ability to think. There are several types of dementia, which is why we usually use the term Alzheimer's disease and related dementia, or ADRD. Today, we'll focus on the most common form of dementia, Alzheimer's disease. Here are some facts relating to Alzheimer's disease. It is the sixth leading cause of death in the U.S. While there's no certain way to prevent Alzheimer's disease, maintaining a healthy lifestyle and managing risk factors can significantly lower your chances of developing Alzheimer's disease. Black and Hispanic individuals experience higher rates of Alzheimer's disease due to a combination of socioeconomic factors, health conditions, and potential genetic predispositions that disproportionately affect these communities. This fact makes it particularly important for the community to be aware of the risk and be assessed for possible dementia. Here's some more perspective on the impact Alzheimer's disease has on others. Almost 20% of Medicare dollars are spent on people with Alzheimer's disease and other dementias. 2 out of 3 caregivers are women. Over 50% are the adult children of the person with the disease. Many caregivers must make hard choices to care for their loved ones. For example, leaving their jobs and making decisions about care when their loved one cannot. Only a doctor or nurse practitioner can make the diagnosis of Alzheimer's disease and related dementias. Some evaluations in this process include a physical exam and collecting your medical history, memory, judgment, speech, and mood tests, blood tests and brain imaging such as MRIs or CT scans, reviewing your medications, and a sleep study to evaluate obstructive sleep apnea. These tests are used to rule out memory and thinking problems that may be caused by something else. For example, depression, medication side effects, excess use of alcohol or other substances, thyroid conditions, vitamin deficiencies, diabetes, kidney disease, liver disease, breathing problems, or heart or blood vessel conditions. There are many possible evaluations that your doctor or nurse practitioner may use to detect for the presence of memory and thinking changes or possible dementia. The goal is to evaluate memory and thinking. The simple word test involves listening to a list of words and reciting back as many as the person can remember. The clock drawing test involves drawing a clock with the hands pointing to a specific time, for example, 2:45. The scenery picture memory test uses 2 scenery pictures. The person is asked to remember as much detail as they can about the pictures they are shown. Another test, the AD8 Dementia Screening Interview, asks questions about changes in behavior and thinking within the last few years. The questions ask about problems with judgment, such as problems making decisions, bad financial decisions, or problems with thinking, less interest in hobbies and activities, repeating questions, stories, or statements multiple times, difficulty learning how to use tools or gadgets, not knowing the correct month or year, being challenged with handling checkbook balancing or paying bills, forgetting appointments, or having difficulty with memory and thinking processes on a daily basis. These questions are asked as part of a scored test that is administered by a healthcare professional. Researchers have identified certain genes that increase the risk of developing Alzheimer's. If one or both parents had Alzheimer's disease, you might be at an increased risk of developing the disease. For more information about this testing, please see your healthcare provider. As I mentioned earlier, there are other types of dementia. Let's talk about 3 of these. To start, vascular dementia. This is the second most common cause of dementia. It can occur after a stroke, mini strokes, or from living with hypertension or heart disease. Up next, Lewy body dementia. People with Lewy body dementia have some of the same symptoms as those with Alzheimer's disease. People with Lewy body dementia may have unexplained falls or problems with sleep. They may see things that aren't there. This is called a hallucination. Or they may have false beliefs about some things that are actually not real. Delusions. Lastly, frontal lobe dementia. This occurs at an earlier age, around 45 to 65. A person with this form of dementia may have problems with goal setting, planning, and taking action, like deciding to make dinner or go to a movie. Memory loss sometimes doesn't happen right away. Behavioral issues in people living with dementia come from a combination of factors, including brain changes due to the disease, difficulties in communication, and environmental issues. Try your best to understand the underlying cause of the behavior. New behaviors can indicate a medical problem. Report them quickly to the primary care team. Work with the person's care team to create a plan of care to manage and possibly prevent behavioral symptoms. Behavioral and psychological symptoms of dementia are common with all of the dementias. It is very important to know that these challenging behaviors are ways for the person living with dementia to try to communicate when they are in distress. Behaviors can include aggression, agitation, apathy, depression, mania, or psychosis. Both prescription and over-the-counter medications are used in treating Alzheimer's disease and related dementias. For example, aducanumab and lecanemab. Not every person with ADRD is prescribed medications. For more information on prescribed or over-the-counter medications, please contact your healthcare provider. Let's wrap things up. Multiple physical assessments and memory and thinking evaluations are conducted before your doctor or nurse practitioner can make a diagnosis of Alzheimer's disease or related dementia. Work with the person living with dementia's care team to develop a treatment plan. Medications may be part of the treatment plan, but this may not be the case for some. Ways to manage behavioral issues should also be part of the treatment plan created with the healthcare team. Thank you everyone for your time today.